So we're going to fight the wind a little bit today. You guys should be all able to hear me. I'm pretty loud. Again, my name is Dr. Jeremy Wirtz. I'm with Elanco's veterinary team. And today we're going to do some necropsy labs. We've got 2 donations and then a freebie over here that we're going to talk a little bit about as we go through them. First off, I want to just see a show of hands. Who comes from a farming or agricultural background? Cow-calf. Feedlot. Horses. Oh, not just kidding. Who's never been on a farm before? First time they saw a cow was today. Perfect. Perfect. Okay. Okay. How about any pre-vet? All right. 1, 2, 3. Perfect. So I got lots of helpers today. So you're more than welcome to be involved. We've got one that we have not gotten into yet, that if you want to run a knife today, that's awesome. You're more than welcome to. This one I've kind of splayed open because we wanted to get a little bit of answers a little bit earlier. This one we've popped the hood a little bit, but there's still quite a bit of work in here. So if there's anybody that wants to glove up, you're more than welcome to. I do have extra larges, which is what I wear. Obviously, I got great big gorilla hands, and I've got some OB sleeves. Mostly hands, just the gloves is what you'll probably need. But I also got some larges too, so if you got petite fingers or whatever, you might just shimmy them up a little bit. And then we'll go over a little bit of some equipment. Obviously, knives are sharp, right? We want them to be sharp. Some of these are fairly sharp. I don't own any stock in the company, but I will be an advocate for Cutco. If anybody is an outdoorsman that does any large animal, this is a great gift for friends, family. They have an outdoors knife with a serrated edge. This thing will gut a deer very, very quickly. Big advocate for this knife. Some of these knives are old fab knives that I've taken because they were cheap and I can put my own edge on them. And then certainly when we start thinking about how we're going to get through some bone, these smaller calves, tree nippers, work pretty well. And we'll demonstrate that a little bit. And then also we've got power tools. Just from a liability standpoint, I will be the one that will run power tools today. But when you get bigger animals, they're a little bit harder to get through those bones. It just makes it quicker. And today we've got 1, 2, 3. If you have a massive wreck and you've got 20 to do and it's going to get hot by noon, power tools will make your time and speed go a lot faster. So before you even cut into an animal, the biggest thing I always like to do is grossly look at the animal. Remember we talked about those questions, right? Ask those questions. And what we asked was how long has he been on feed? How long has he been at the farm? Has there been any changes in pen dynamics? Have they keep adding cattle to it? Has he been treated? This calf's been treated twice with Nuflor and telithromycin, which is generic Draxxin. And then he's been volunteered to be part of our demonstration today because if you look at him, you can see that grossly, we see bones sticking out, meaning he doesn't have a lot of fat cover, doesn't have a lot of muscle mass. You can see he's just kind of doggy looking, rough hair coat. You know, those are some things to take a look at before you even cut into them. And Matt, if you want to say kind of where they came from.
So these 2 calves, about 39 cows, they are in the business of buying lightweight, high-risk yearlings from sale barns. They commingle them, and they figure in a death loss into their profit margin. So they know what they're doing. They do not vaccinate. Okay. So these calves, this one, like he said, has been given Draxxin and Nuflor. This one only had Nuflor. Twice, treated once. But they factor in their death loss and understanding they're going to happen. So they'll buy calves that are anywhere from 250 to 300 pounds, try to grow them to 750 to 800, depending on the market. Most of the cattle are all out on grass. Some will go to wheat. So, but that's their business model. Okay. Young, high-risk calves.
We'll start on the big calf over here. The story behind it is that he come from right over here, and that he kind of thought that maybe he was stuck. I've kept part of this open here just so you can see how big this calf is. Obviously, he's pretty bloated. And I wanted you to see how big this rumen has gotten due to the gas in there. Now, recognize that I've peeled the skin and the ribs off of this calf to allow that to expand even more. So think about how much pressure is pushing on that diaphragm. Lay down and let me stand on your belly and tell you to breathe hard. That's essentially what we're doing. And so then I open this chest even further, and then these lungs, you can see, are extremely hemorrhagic. See that dark pallor color? You can even see some blood pushing up through those deals. Just by sitting here for the last 40 minutes, you can see how much of that pressure that we've taken off to allow that blood flow to come back. And that's why you're seeing all this blood, this black layer on here. This is dried blood that's seeping out of those lungs. Same thing when we look at the spleen. This thing's changed colors quite a bit too. And see how much blood we've got in there and extremely dark it is? That's from congestion, meaning that our normal blood supply and blood flow to the back of the animal has been changed due to how much pressure we have. We've basically suffocated the bottom half of this animal. When we look up here in the brisket and in the throat latch, you can see extremely how hemorrhagic this tissue is. We've basically congealed all the blood to the front of this calf. So not only are we putting pressure on those lungs, making it hard to breathe, we are not getting the blood supply to the back half of this calf. And just fair warning, sometimes you guys are in the splash zone, so this can get a little messy, but I'll try to not get you guys. And so when we start getting into the abdomen a little bit further, this calf's going to have some hemorrhage in here. One of the things I did notice was when I rolled off, he had quite a bit of bruising on his ventral side, probably from laying down and thrashing, trying to get up. The story that I heard is that they think he got over-centered and was unable to get up. And so with that, he's basically got some bruising associated with that. So who can tell me how many stomachs does a cow have? Can somebody tell me all 4 of them?
Okay, that'll be on the exam.
So we've got the reticulum, the rumen, the omasum, and the abomasum. And essentially what we're looking at is when we think about fermentation, is the rumen. The reticulum catches all those big particles out of there, and they all have some differences. So this big vat here that was so loaded and full, that's the rumen. So you can see that the carpeting here is what helps with that microbial breakdown of all that feed. So that's the inside lining of that rumen. It looks like shag carpet. Oh, here we go. And then our reticulum kind of catches a lot of those big ones. And you can see it's more of like a grid pattern. And so when we have this, these differences are how we break down all the fiber that are in these diets. So this is reticulum. And you kind of see that pentagram type grid system that's in there. Helps break that down. And then our rumen, more like shag carpet. And then this will probably be. And then when we think about enzymatic digestion, which is what we as monogastrics do, or pigs do, we have our abomasum. So this is what's kind of called the true stomach. And this is where they start having enzymatic breakdown, no different than, say, like a pig stomach, a dog stomach, or our stomachs alone. The omasum, buried in over here. We may not get to it. But essentially what happened with this calf was he got over sideways, couldn't get up, was thrashing, started to bloat because he couldn't eructate, get that gas built off of him, and essentially put all that pressure on his chest so he couldn't breathe very well, put him in distress, and then also we were having poor blood supplied to the distal end of the calf, mainly because that bloating was pinching off those arteries and veins. And you can even see, like I said, all the congestion up in this up half of him, where all that blood was stuck up there. couldn't get back. That puts pressure on the heart too. If your fuel pump's not working, your truck's not going to work. And so same thing when you think about the heart and stuff like that. I don't see anything different here. This green kind of stuff you see in the guts, some changes here. That's just what's called from agonal death. Changes that happens in these guts a little bit. Calf was eating pretty good. You can see quite a bit of corn in the diet. You know, and you can see quite a bit of fiber steak in there as well. You can. Sometimes you can look at the lining of the rumen. Where I usually like to look at it is from a subclinical standpoint, where you'll see kind of chronic lesions in the rumen. Some people say they can smell it when they cut those rumens open. I don't think I can, but certainly you can see some differences in the rumen. One of the key factors too is if you look in there, where you'll see like if cows have been grazing drought corn, or they've been grazing corn stalks that have been from a drought situation, or there's a nasty hail situation, and those cows just loaded up on corn. Sometimes you'll roll that thing out, and it's like opening the grain bin, and you'll find it just corn over corn over corn. So sometimes if there's a misfeeding or a cow gets into something, you'll find those types of things. Those are pretty straightforward. Those cows died from an acidotic event. But certainly you can start looking at some of the rumen. Now this calf here, very healthy rumen. It's got that good long shag carpet look to it. And so very healthy rumen on him. I don't see any lesions from like any blood spots or anything like that on that. And then certainly the reticulum looks very, very healthy as well. So from a subclinical acidosis or even an acidosis event on this calf is probably low on my radar. So, but certainly something you want to look at every time. So, lungs didn't look too bad. There's a little bit of some old pathology on the cranioventral that's kind of dried out here a little bit, but pretty straightforward. All right, who can tell me what this is? Good job. You always want to look at the hearts on cattle, whether it's an old cow that died or a young calf that died, because you can find a lot of issues in the heart, and you can be amazed at how long these cattle can last, especially if you have like an old cow, how much vegetative carditis they can get. And so a lot of times there's a couple different ways, depends on who taught you how to cut a heart open. Some people will bread slice them. Some people will come up through the arteries and follow them through. I usually cut the bottom part of this thing off because then I want to be able to look at those ventricles. And so obviously our left ventricle, that's the one that pumps blood from the heart to the rest of the body. And we have our right ventricle that pumps blood from the heart to the lungs. So this needs to be very strong. And you want to make sure that they are not equal. Obviously the left side, quite a bit thicker than our right side. That's pretty common. I don't see any major serious issues with the differences in the thickness of that. Looks pretty normal. A lot of times I also like to follow these things up, split these open to look at the heart valves. And so if you've ever heard somebody have a heart valve or they got plaques on their heart or something like that, a lot of times that's to do with the heart valve. And so when we see these heart valves, we want to look and make sure they're nice and smooth and clean. They should be about as thick as a piece of paper, but look like tissue paper. And so then here's a really good heart valve here. You can see there's a little bit of some hemorrhaging on the back side of this. More than likely that's from agonal death. He just struggled enough at the end of his life. Why is some of this important? There's only a hand of you that are pre-vet. Some of you might be thinking, well, I don't have to do this. I'm just going to watch today. You may not have to do it every day, but if you were working on a feed yard and your veterinarian can't get there to do this, he's going to ask you to do it. And so definitely take some of these ideas of being able to take pictures is very important, and how to open a chest, and which we'll show you on that black calf how to do that. But a lot of times they might say, give me a cross section of the heart. Basically bread loaf that thing, take a picture there, bread loaf again, take a picture there. Because what we want to look at is some of the differences in color on this. Now this heart looks very, very good, but you might see a bright purple spot That would indicate some sepsis, or you might even see a very, very light spot. That would indicate some necrosis. Those would be things that if you called and said, hey, I can't get there, dead truck's coming, you cut him up, see what you can find, send me some pictures. Those would be the things that I would ask for. But pretty straightforward on this calf from a mortality standpoint that he bloated. Okay. All right, so I've kind of got into this one a little bit. And so essentially when we do a necropsy, what we want to do is a lot of times I will elevate this leg up. I will cut over, lay that leg flat. And then same thing with the back leg, cut. Anybody know what that exact thing is? Hip joint, perfect. That's the head of the femur right there. There's a little thing called the fovea capitis, which unless you're a pre-vet, you're not to know that freshman anatomy. It's a really good way if you cut that sucker, this leg will lay nice and flat. And then you just kind of roll this over and then roll this muscle layer back as well. And now we've exposed our abdomen and we've exposed our chest. Now I use the nippers along here to open this chest cavity up. And the first thing that I noticed right off the bat is, hey, we got a really nice pink lung back here. But we've also got really, really bad, ugly lung up here. And so that's one of the things that we're looking for in these type of calves in this scenario is what kind of lung pathology do we have? The fact that he's been treated twice tells me that more than likely, and the fact that he's not gaining or growing, he looks pretty ill thrift, that we're probably going to see some serious lung pathology. We can take this lung and look even further that this is old pneumonia. Some of this stuff back here is new pneumonia. So we're starting to even see it up in here. We're starting to see some differences here where we're starting to see the air get locked in there. It means there's been an inflammatory infiltrate in there. Now you may not be able to see it directly, but there's some microhemorrhaging on the face of this lung. The other thing I want to show you is if you can crack a chest and get it to this right here and take a picture, very helpful to your veterinarian.
What is a healthy lung supposed to look like?
More like this up here. Kind of a nice pink color. I would say this is somewhat healthy up here. When we get further into this lung, I'm just going to take this lung lobe out. Well, and look here, here's another one. You see this right here? You can get real close. That's what's called a fibrous adhesion, meaning that chunk of lung has died and got stuck to the wall of the ribs. Typical with Mannheimia. Very typical with Mannheimia. All right. So we've got our lung lobe here. We got our nice cutting board. So this is toward the head of the animal. That's toward the tail. Spine runs right along up here. Some differences in that lung for sure, correct? We got unhealthy lung. That's old. And even on the back side here, we're starting to see some changes from a new pneumonia standpoint. So something a bit fresher. Also in this area as well. And we're starting to get some septal defects in this as well, where we're starting to get air stuck in here. And if I cut the edge of this thing, you can see that we have some hemorrhagic edges to that as well. And I would bet to say that we might find something fun when we cut this icky lung open too. So we got some pus in there, some micro abscesses, and then certainly the cut face of this lung is all scar tissue. All that scar tissue compared to a little bit fresher lung there. And so quite a bit of lung lobe damage to this calf. You might think, well, shoot, he's got a whole bunch of lung. Why just that little piece? Is that enough to do it? It is. It is potentially. You'll see these calves sometimes last long. You go to the fab floor, the kill floor at a plant, you might cut open some lesions that you're just like, holy moly, how did that animal even survive? There's a couple lymph nodes in here. They might still be in there. But they're really, really good to look at as well. You can even see some of the differences in this lung here from the inside compared to right here as well. One thing too is, hear that? Sound difference. Because this lung is so much more dense. It has no air in it because it's all scar tissue. So basically, necrotic lung right here, useless to the calf anyway. Well, I guess all of his organs are useless now. But that difference in that sound, there's still air in that lung. Not in that one. Bunch more abscesses. See the pus coming out of there? So, dead necrotic lung on him. All right. We're going to get in the rest of this calf here. If there's anybody that wants to jump in, absolutely.
Do you know what killed him already?
No. I have a sneaking hunch. You know, and that's one thing as a veterinarian that I always am ruling out ideas or differentials. And so, with him, I'm betting he was a chronic. And we haven't even looked at his other lung lobe yet. Oh, yeah. We'll see some cool stuff here in a minute. Yeah, so generally you want them laying on their right-hand side. That way the rumen sits on top. If you're specifically looking for something or something that's guided you to do it another way, you can. But general rule is to lay them on the right side, cut the left open. All right, so a lot of times we'll pull the whole pluck out, which will be essentially tongue all the way down to the bottom of the heart. I didn't go that far up on him. He's got quite a bit of adhesions on the bottom side. You probably can't see it without coming in here, but there's a whole bunch of this type of stuff that's adhered the bottom of his heart in his pericardium, which is a sac around the heart, and the bottom of those lungs, the bottom of that chest. So a lot of just like scar tissue, maybe the best way to describe it. It's fibrous, and he's got a lot of that in there. Very similar to that piece that was kind of up here on that rib. And so if we look at this lung here, turn this around, we definitely see some changes in it as well. This lung probably worse than that other one. You can even see that he's starting to get some, so we think cranial, ventral, caudal, dorsal. So back of the calf, back of the lung. Oh yeah, yeah. So all those little white pieces are micro abscesses. Think of his lung just completely full of pus and scar tissue. And then, and that's old. That's not anything new either. I wouldn't say it's super ancient, but it's not fresh. And you can see that we're starting to get some other stuff down here in this lower part of this lung. So that hemorrhage that we're seeing in there is because we've built up so much scar tissue that we can't get the blood flow through our lungs. And so it starts to back up. And so then a lot of changes in this lung too. This is old lung here. This is some newer stuff. So it just, traffic's backing up. It's getting worse the more traffic you add to it. There's a little piece of decent lung. Not much. And then we get over on this back side again here. We can see it's starting to infiltrate up into here as well.
Are there sections of that lung that bacteria affects first, or is it just kind of wherever?
Yeah, so gravity will say the front half, right? Because when you breathe in, it's going to hit that front lobe first because there's a tracheobronchial tube that comes off down to that cranial ventral lung lobe. And that's where you'll see a lot of Mannheimia issues start. But then it can spread because it's so much vasculature that just on a super highway, it can get everywhere in the lung very quickly. This calf specifically, same thing. That front half of this lung is trashed. It's garbage. So this calf has had old pneumonia. Not much air coming in and out of that for respiration. And then again, we've got some more abscessing going on, which is indicative of that necrosis. What's that? Could have been anywhere in his life. Based on what I see on this calf specifically, some of this stuff was probably even prior before they even got him, or fairly soon afterwards. Some of this other stuff's fairly new. I would say sometime in the last month. Like some of this back here, I'd say that's probably sometime in the last month or two. So some of this newer stuff that we saw in that other lung was probably like in the last week, 10 days. So it's based off some of the tissue damage more than anything. And color is a part of indicating damage. If you rely completely on color, you're not going to get the answers you're looking for. And so sound, which that's kind of one of my tricks, and then certainly density. If you want to throw gloves on and feel that versus feel that, this is nice and spongy. This is really hard and dense. And then certainly you cut that open and you start seeing pus roll out. You know that's old because it's got to have a lot of tissue damage there. So definitely severe chronic pneumonia. Scale of 1 to 10, I would say probably a 7 or 8. Mainly because I don't think he's full of mycoplasma yet. But if he lived another month, I bet he would be. Perfect. Glove up. And I've got some larges and I think extra larges somewhere in around there. All right. Again, we're going to look at this heart and cut the bottom off. Get the blood clots out. And we're looking at the face of that heart a little bit. And so this one's a little bit more subtle, but something that if I would send this heart to the lab for a board certified pathologist to look at, something that I would have them look at specifically on this heart. See that dark purple spot there? That dark purple spot right there at the tip of that knife. It's darker purple there compared to even say over here. The darker purple spot. A lot of times that's associated with Histophilus. You'll start seeing some issues in these heart cardiac muscles if they have a Histophilus issue. Not to say that that's what killed him, but it's definitely on my radar for sure. Which makes me want to explore this heart a little bit more, see if we find any other issues. And so, even in here, we look on the inside layer of the heart. This is what's called a pectinate muscle. It runs the chordae tendineae, which runs the heart valves. You can see the bruising, hemorrhage on that, right at the tip of the knife. It's also a lesion associated with somnus. We know that this calf did not have a prolonged agonal death. Does anybody know how he died yet? Anybody? High-speed injection of lead. So he was euthanized, but certainly some of these superficial lesions of this heart that we're seeing would probably deteriorate him over time. All right. Yeah.
Now, when you say they don't vaccinate, Clostridial, no viral, no nothing?
So it's not. I don't know that these calves haven't had any vaccination before they got to their operation. I know typically they kind of have the opinion that whenever it started.
All right, I'm gonna roll this abdomen out, or this stomach out, and you can just go wild.
Calves may have had something on the cow or maybe younger.
Does anybody like fajitas? Skirt steak, diaphragm. If you go to an authentic place, that's probably what they're feeding you. This cut of meat. They do a nice job with it. All right. Where do you think the kidney might be? Yep, it'd be in the abdomen. So when you think about where it's at on a human, we're standing up, kind of toward the back. This animal is obviously four-legged. So when we think about where his back is, probably going to be up further this way. Happy hunting. And so we can start pulling some of these intestines out. Intestinal health is important, when you, especially in these young calves, when you think about coccidiosis and subclinical coccidiosis. That's why we feed Rumensin to help prevent that. Where you want to look at these is if you have a doggy calf that's not gaining or growing, you can do some fecal sampling on them to see if they have coccidia before they die. If I was worried that this calf maybe was a cocci calf or we thought there might be issues with it, this is where I would start looking, is in the small intestine, and then certainly clinical further down in the large intestine as well. And so a lot of times these guts will get very red and inflamed, and they'll be very thick. Whereas you feel that, not real thick, kind of rubbery. Pretty healthy from a gut standpoint on this calf, but you can certainly check for toxi from this standpoint as well. It does look like he does have some enlarged lymph nodes. That's something I kind of like to look at on these, but nothing too crazy that warrants any major concern in it. All right, kidney. We're looking for a kidney, right? Yeah. Any idea? Yeah. Do you know what they look like?
Yeah, they have like little nodules.
Yeah, they look like a bunch of grapes on them. Absolutely. Staring right at you.
That's a big.
Yeah. We'll cut it open. So what I would do is watch your fingers, obviously. Pull this thing out. Cut right along there. And so here we've got the kidney. It's got an outer capsule layer. So you want to take that and try to peel that off a little bit to get down into that layer to be able to get a good look at it. You can see that. See how he's kind of got some of those specks on there? That's pretty common. You'll see that. You think that might be pathology or sickness or something. It's not. It's just the way he died. Sometimes they will get that. And so then a lot of times what you want to do is you want to cut these things open to get a good look on the inside of this thing. You will see with acidosis effects that sometimes these cattle will just randomly die, and you'll cut open these kidneys and there'll be some just abscessed and they look very, very nasty. A lot of times that's from a subclinical acidosis or an acidosis event. The bacteria get in the blood, goes straight to the liver, kidneys, and it just fries those kidneys up. So inside of a beef kidney, anybody ever seen the inside of a beef kidney? Grandma never cook you kidney pie? Mine didn't either. I don't know if I'd eat it either. But kidney looks fairly healthy. Nothing to red flag in the kidney about. Looks pretty healthy. Just some petechial hemorrhaging on the surface, basically just some agonal dying of the kidney tissue. So when we think about a case like this, if say you called me and said, hey doc, I need you to come look at some steers that died, things that I would ask for based on the history of this calf is can you pop that chest open? Give me a look. Pop the hood a little bit. That's what Dr. Blue used to always say. Pop the hood, see what you see. And with that, we could have seen that pathology in the lungs right off the bat, and we could see some of the changes in the back half of that lung as well. And so, do I expect you to be able to cut this heart open, look at those chordae tendineae, find that little purple spot? No. Some guys I do, but you can definitely see some differences in there. One of the other things too is when we think about two diseases that we've talked about, is certainly digestive and respiratory. What are some other issues that we can see? What about toxics? Nitrates? You guys ever deal with nitrates down here? I know you guys do. So Sudan grass, drought corn, nitrates can be a big issue. If you want to find out if you've got nitrate issue, you want to grab that liver, take a chunk of liver. But if you can't invest into this that deep, one really quick trick that you can do, it's called ocular fluid. Take a 16 gauge needle, 12 cc syringe, poke it right into his eye, pull the jelly out. That is a great diagnostic sample to send to a lab to check for nitrates. Very quick and dirty trick too. Dr. Ensley at K-State prefers that over liver. And he's probably one of the best toxicologists in the world in my mind, from a veterinary side. We'll pull this liver out on this guy here, or at least a chunk of it. All right, so we got our beef liver. Grandma ever cook you liver and onions? We getting closer? No, okay. So a lot of things we want to look at from the liver standpoint is, does it look uniform? This one does got some changes to it a little bit. Nothing that warrants any major concern, but certainly some of the purple splotching that we see there, that can be some differences in the intricate parts of the liver. And everybody know what that green thing is hanging there? Gallbladder. All right, extra bonus points on the next test. Who can name an animal species that doesn't have a gallbladder? Yeah, horses. Nice. I figured there's some horse folks here. A lot of times people will want to decompress that. You can get kidney stones or gallbladder stones in cattle. So a lot of times when I pull these out, I'll decompress it to see how it feels. You can see if you look right here, as I squeeze this. So gallbladder is good and patent. Looks good. And then same thing, red slice this thing open just to make sure you don't see anything. We're probably far enough south that you could have some issues with liver flukes. In the liver? No, I don't. Are they on Thailand? Yeah, so a lot of those splotches on here are just superficial. You can see kind of this bigger one here goes a little deeper. Probably some sort of infarct. But you want to slice this thing open, look for liver abscesses. Again, acidosis can kind of help lead to some of that. But then also, you want to look for draining tracts for flukes. Me in Nebraska, if I find a fluke, it's very rare. Unless those cattle have a history of like, hey, we bought these cattle from Mississippi, we brought them to Nebraska to feed them out. Not to say that we don't have some in some low-lying areas. We just need to have the right environment for it. And there are some lower areas that do have that middle intermediate host for flukes, which is a snail that live in some of the sub-irrigated ground in the sandhills. So we do see it a little bit, but not very often. Not very often. Somewhat. And a lot of times I have been associated with the fluke issue in Nebraska on feed yard cattle. And in the history, those cattle came from southern Arkansas. And they were on the Mississippi Delta, down in that area where the Mississippi comes to Louisiana. And so it was pretty straightforward. It's kind of a wild deal. So that was many moons ago. Yes. Yeah, so liver abscesses do a couple things. Number one, they're going to slow down your ability to liver to do its job, right? If you're basically getting a giant abscess in there. But you're going to also have a lot of adhesions from it. And those adhesions start causing trim. So now all of a sudden, we got to take a chunk, throw it away. Now we got to take another chunk and throw it away. So that does two things. Slows down the fabrication line at the slaughterhouse. And then not only that, but that's lost pounds. They can even go as far as to condemning the entire carcass and it gets incinerated or ground up. So it won't enter the food supply. That's lost money to the producer and to the packer. And so very, very important that liver abscesses are controlled. Obviously, there's a lot of great products. We've got a great one that helps with that as well. But I definitely think when you think about chronic liver abscesses, it's those adhesions, trim, and extra time on the line that really, really set that back quite a bit. Sarah's the queen of those.
High performance impacts too. So severe liver abscesses where there's multiple small ones, those animals will perform worse when they're high. So you'll have less intake, less gain. So it's an issue for both sides, the feed yard, the packer. So we try and control those any way possible. Thailand is the best solution that exists.
There were a couple of
Yeah. You have to remember too, there are a lot of meat parts of the animal that we don't eat here. Overseas, right?
Yes.
Now, I'm probably the oldest person here. So when I grew up, liver and onions, unfortunately, something we ate quite a bit. I hated it. But a lot of these things factor in, like you said, trim, fabrication. It all comes down to lost dollars.
So there's a little bit of some healthier lung, and there's the unhealthy lung. All right, I need another pre-vetter. Help cut this guy open.
Dr. Ward, I got a question.
You bet.
Can we go back to the heart real quick? You said that lesion.
Yeah.
And so on longer day cattle, you can kind of the telltale sign is more or less at the bottom of the chest for it. They get more, I don't know if that's buildup or fluid. And what does that look like on the inside? I've never been able to cut one open.
So a lot of times what you'll see is that subacute edema or superficial edema is you'll start seeing those tissues spread out. And when you cut into them, the fluid will roll out of it.
Okay.
Yeah.
Got it. So like, where would that fluid be? I know you can tell there.
You'll see it. Yeah, you'll see like a heart failure stuff. You'll see down here. And this calf, obviously, he doesn't have a lot of fat on him. That's the first thing I noticed on him. So if they don't have a lot of fat on them, that means that they're not either eating and gaining and growing, because they should have some fat in them. I mean, even around that kidney, when you pull that kidney out, was there any fat around it? None. So this calf was redlining from a nutritional standpoint. But if you have a big full brisket, like on those big fats, then you'll see that thing swell up. And think of like an Angus genetics from like 1980 with a big old deep chest on them and no guts in them. That's what they kind of look like. Not to pick on anybody who's Angus breeder. But they'll even get it all the way up their neck. And sometimes what that fluid does is it starts pinching off some of these veins and arteries that come through, and they'll get a bottle jaw too. So if you ever see something like swell up underneath their jaw and down in their brisket, a lot of times that's what your heart failure is. And when you cut that open, you'll see all those tissues are really congested with a lot of fluid, because it's not blood, it's just that fluid doesn't have anywhere to go, so it just starts building up and building up and building up, and to the point where that heart just can't handle that fluid being gone. So definitive diagnosis, not 100%, but I would suspect that chronic lung lesions leading to some newer pneumonia as well that would probably kick this calf over the bucket. So that's why he was selected for euthanasia, because they knew that he wasn't going to last around very long. All right, let's go ahead and let's roll him over and we'll start cutting him open. All right, who wants to cut this steer open? You guys have seen two of them. See one, do one. A couple tough guys, come here. Come grab him and help pull this thing over. That way we can kind of pick him up and just scoot him over here a little bit. That way we can get him. Perfect. All right. Put him down this way. One thing too to always note is identification. You want to make sure you're writing notes down, because don't expect you to remember them when you get back to the truck. All right. You know how to run a knife? Ever done this before?
Nope.
Okay, we'll do it together. So, if you have an assistant, it's great, because then they can kind of help pull things up. But a lot of times what I'll do is since I'm 6'3", 230 pounds, I can kind of manhandle this thing around. And so you want to kind of aim for this armpit, stab, and just run your knife around there. See how that opens up? And then you just take your knife and you peel that shoulder blade back. So you can just cut right along there. And he's dead, you're not going to hurt him. Anything that's got tension, cut it.
You've done this enough. How fast have you got a deer?
10 minutes, 8 minutes. Yep, wherever there's tension. So I think there's a lot of tension right there. Yep, there. See how that flopped there? Okay. And so then same thing, we'll do it on the back leg. We'll roll this one out. One of the things too, and I looked at these prior, is before you get into them, look at them. Is there anything that warrants any major concern that you can see? You know, obviously if a calf's got a broken neck because he got hit by a truck, do we need to really check all the insides? Maybe we do from an insurance standpoint. But one thing I really think it's important is you roll these things up, look at their navel. That's more important than, say, like beef on dairy, young calves, or baby beef calves. And also look at their cod. You can see that this calf was probably recently castrated or banded not too long ago. And it looks like it's pretty much healed up. But if you reach down there and see a giant abscess there, okay, well maybe that's why he died. Or if his navel's the size of a balloon, probably how he died. So you can start collecting information and data as you go through with this. Another spot that you can do from a diagnostic standpoint is if you get comfortable enough to get into this hip joint, there's a little bit of fluid that sits right down on the bottom of that hip joint, that hook and socket part. If you can collect that with a syringe, you can find a lot of really good information about how that calf died from a septic standpoint. All right, so now we've got two holes, right? We've got to connect them. The best way to do that is we just want to come right under the skin, and if you cut over the top like that, you'll dull the hell out of your knife. So it's better to come from underneath the skin and work up. But you won't want to get too deep, because then you'll hit some fun stuff down there and it'll get you all stinky. So if you want, just go ahead and just slip that knife up underneath there and just kind of pull it on up a little bit. Use the blade of the knife. One thing about knives, guys, And I know this is where you listen to the preacher, you preach what you pray, but you will cut yourself with a dull knife more than you ever will with a sharp knife. That's also one of the reasons why I'm an advocate for Cutco. You don't know how to sharpen knives, you're not good at sharpening knives, guess what? They do it for free for life of the knives. Knives are expensive, so take care of them. That orange bladed knife with the gut hook, I think it's about 130 bucks. These, as a full fab knife, run anywhere from 150 to 200. This is a Victorinox, which is a really good quality brand. Nice job. And so now we got to peel this all back. And so if you've ever skinned a deer, same thing. So I'm already looking at things. One thing I've looked at is what color is this tissue here? What's that muscle look like? What's this shoulder look like? One thing I definitely see, quite a bit of some different changes here from a vascular standpoint. We're seeing some bruising on the top side there. That could be septic related or it could be just trauma. And then to get into these cattle, you want to find the edge of their ribs. The ribs are kind of what separate our abdomen from our thorax. And so what I like to do is I cut right along the edge of that rib line. You can see that's where the bottom of the ribs are. It goes down to the sternum here.
You were talking about septic and everything. Have you ever done too many water bellies?
Yeah,
Yeah.
I don't like them.
I heard they're like 50-50, kind of like.
So there is a, are you talking about like doing the surgery to save them?
Yeah.
Yeah, so with a water belly, what a water belly is basically urinary stones, and they get caught up in the urethra and the penis. And so this calf's penis runs about, oh, it's right down here. Right here. And he's got a urethra that comes all the way up to here. And a lot of times they'll get filled with stones and they can't urinate. Their bladder starts to get so big that it'll actually rupture their urethra and they'll get a bunch of urine that starts pooling in the bottom of their belly. Between the layers of skin. You'll see it like right here and then even a couple layers deeper. So what you do as a veterinarian is instead of him now urinating here, you come to the back side of him and you dissect out where his urethra comes down through here. It's about 1.5 inches in there. And you just basically dissect it out and you give him a new pee hole, essentially. So now he pees like a heifer instead of like a steer. Like with them, yeah. Even a good surgery, you're probably 50-50. Yeah. All right. All right, so we're getting our abdomen opened up, taking good care to not cut anything that we don't want to cut yet. And now we're going to get up into the chest. Was you want to run them?
Nope.
All right. Okay. So these are simple tree shears from Home Depot. They work very well on these types of size cattle. They don't work so well on those bigger ones because the bones are a lot bigger, a lot harder. So you come over the top like this, and we've got a little bit of tissue to get through. And you just run it along the top of those ribs. Cut and twist. Cut and twist. All right, who's my pre-vetters? All right, it's very straightforward. I've already got a good line for you. And it's if you sit there and kind of tickle it, it ain't gonna cut very good. So what you gotta do is just get a good bite and snap it. All right?
This is gonna be embarrassing if I don't get it.
Ah, it'll be all right. Give her hell. Yeah, there you go. How are we doing on time?
It's 2:25.
Perfect. All right. Well, we'll see how many ribs. How many count?
I didn't count.
Oh, okay.
I was just cracking. I wasn't counting.
We'll see what we got left here.
I was going to like couldn't get that further.
No, that's fine. And so what this does is when you do it this way, it allows for you to be able to look at the back side of the diaphragm, which is right here. Gives you a good look at the spleen, which is right here. And then we'll come this right on up here. And then you can kind of get a good look as if there's any adhesions starting to form. Gives you a good look down at the liver right there, right here. Allows you to cut that off. It depends on your lab, and depends. So the question was how many necropsies you do? As many as you can. This is a skill set when you graduate veterinary school that they expect you to know. The industry expects you to know how to do. Oh, this one's going to be a good one, guys. So look at all the adhesions we see here. That's not normal stuff right there. That's all icky stuff, pathology. And then obviously our lung is literally solidified to the backside of our ribs. We'll see if we can get this thing pried away here. Oh my goodness. This guy wasn't going to make it this afternoon. No, nothing was going to save this guy. No. So when you talk about those late term feeding periods, and somebody says, oh, I'm just going to use this new drug if it's so fancy and good, it doesn't matter what you do that. I don't think holy water would fix that. He could have gone to church all he wanted. I still don't think it'd help him. And so this is the point where a picture would be great, right? You can send me a picture of that. That's good enough. Then I have an idea. What I'd tell you to do after that is say, well, we've been dealing with a lot of this. This calf, say, wasn't treated. We want to send some samples in. I'd say, grab your knife, cut a chunk of that off, and a chunk of that off, and a chunk of that, and we'll send it into the lab. When we get this lung out, I bet we find some crazy stuff in it. All right. There's another one of those adhesions. If you haven't seen what I've been talking about with an adhesion, that lung is basically super glued to the backside of the ribs, right there. That's a big one. Let me steal my mat real quick. No, you're fine. One of the things I always say when I was in practice, if it was hard or difficult, but needed to be done, make it easier. My back was getting sore because I've done 2 of them already. Well, make it easier. Well, creature comfort's huge because then I'm not focused on it. I don't get fatigued as much. But, I mean, we can see that this lung is pretty bad shape, right? I mean, there's even going to be an abscess here. So, and I would bet to say that majority of this lung is probably that. So how would you like to have pus in your lungs? So based on that alone, we can say this calf died of pneumonia. Chronic pneumonia. But don't get that tunnel vision that you're like, oh, it's pneumonia and you quit. We still got to look at the rest of this stuff too. But we have a pretty good working diagnosis of what caused this calf's death. See all that? That's all necrotic, dead, rotting lung inside that calf. And we're not talking one small part. We're talking, I'd say probably 3/4 of his lungs are shot. This guy wasn't going to make it. The first day that got to 90, 85, he'd have been done for. Just no way. This was a good candidate for selective euthanasia. Look at the size of that abscess. And that's the size of a quarter, 50-cent piece. This calf was a ticking time bomb from a standpoint, from a BRD standpoint. Yep. So, I'd like to find some healthy lung. Sounds like beating on wood. This one's because he's got it full of abscesses, and so there's fluid in there that's sloshing. You can hear the air still in that lung. There's no air in that lung. One of the things that I do notice too about this calf is this heart looks way bigger than what it needs to be. You compare it, I mean, these calves are approximately similar sizes. So I said something about the lymph node in that lung over there. Sometimes you can find them. It's right there. That thing should be about the size of a snow pea. Maybe the size of a dime. And that thing's bigger than a golf ball. And we might even see an abscess inside it as well. Yep. So it's abscessed as well. So that's how much this draining tract of this sick lung was draining back into those lymph nodes already to get them things swelled up. This is about half of that lymph node. And like I said, the full size should be about the size of a snow pea. And then, like I said, I think this heart's a little bit abnormally large. You want to look at the surface of the heart too. Yeah, so remember when we looked at the heart over there, that there were differences in the thickness, right? Look how much thicker this left side is compared to that. Now, they're not supposed to be equal, but this is extremely thickened to the point where I'm surprised he was pumping enough blood as it was. Could that be related to the pneumonia? Yeah, absolutely. Basically, this heart was working so hard that the skeletal muscle started to hypertrophy and grow. And so that left ventricle basically got too big. It grew in on itself and now couldn't pump enough blood out of there. So that'd be something that I would note in my pathology report or my necropsy report to say, hey, we had thickened left wall. What's the sides of it look like? Yeah, looky here. Remember that purple spot I said on that last one? Right there. That'd be something I'd send to the pathologist and say, hey, at the lab, will you take another look at that? See the purple coloring there? Purple coloring right on that outer edge.
So if the lungs didn't get to him first, would he be a candidate for heart failure?
I don't think he'd make it.
I don't think so.
No. I'd be surprised if I saw this calf another 100 pounds ever. Just based on the lung, number one, but then some of the changes that we're seeing in the heart, that he probably wouldn't be super clinical, say like a big fat weight would. A lot of these calves, if they died from heart failure at this stage of the game, there's something else that's causing it. Yeah. Which, with this guy here, see that purple lesion right there?
So is this pretty common to see then? Or?
And these type of cattle, yes. Yep. And so that's one of the things to think about too is well, why does this producer buy these cattle? If he knows that he's got a doctor in death loss and treatment, why does he buy them? They can take a lot of these calves, get them at an appropriate price, and add value to them. You ever heard the term, they clean them up, send them out? That's essentially what they're doing. What they're doing is getting some of these things worked out of them. Now, will they get them all? No. This guy, no way. That red calf, he'd been treated twice and we still saw quite a bit of lung. He'd been one that they'd got more time and effort into and probably died then. So from a producer and management standpoint, they can certainly find out the calves that are gaining and growing in the group and the ones that are not. And so yeah, this lung here, that's completely consolidated lung, basically full of scar tissue. Some micro abscesses in there as well. Another one, backside of that lung on the other side. You can see the pus just rolling out of that. So definitely this calf was a chronic. Would not have made it any further than what he did. I gotta grab another glove real quick here. All right, anybody else want to do some cutting? We got a whole abdomen to open up yet. No takers? All right. Anybody going back home to the feed yard back home? Grab a pair of gloves. Congratulations, guys.
How's it going on?
Yeah, I guess so. Jesus.
All right. So we're down into the abdomen. I did all the fun stuff with the lungs. And what we want to do is we want to roll this thing out. And so the best way I've always found is you can either lift it up and out, or you can cut down the belly and it'll roll out on its own. And so just take it, start pulling, and anywhere you see tension or adhesion, you want to kind of slice. Now be careful, knives are sharp, right? So we start there, go ahead and pull that on out. Yep, and just kind of pull, pull, pull. Yep, pull her on down and out. It's all right, we're gonna cut it open. Yeah, so now you essentially eviscerated the stomach out of him. So what we've got, no, that's fine. You got to make a hole somewhere. And so now when we look at the rumen here, our rumen's going to be here. You can see, does he have near the carpet? That fancy carpet? It's actually kind of smaller. And you can see a little bit down here on the dorsal edge that it gets a little bit more thicker carpet. But generally, not near as much. So rumen health on this calf wasn't near as good either. Remember when Dr. Leline talked about the nutritional demand that the immune system has whenever there's a disease or illness? It's diverting resources away to fight that disease or fight that infection to where it's not going to put it back into production value. It's not going to put it into gain and grow, and we're not going to have near the healthy rumen that we had. This is the stomach we didn't see on that big calf, but this is the omasum. They call it the mini ply or the rumen Bible. And what this does is it actually helps pull a lot of the fluid out of it. And so you can see all the pages in there, right? And so it's got these layers in there for helping to push all that fluid out of there before it goes into the abomasum, which will be down over here, which is their enzymatic stomach. And he was even, so here's something to note. So I always like to cut these abomasums open. Do we know, do they deworm these cattle on arrival? They do? Do you know what they use?
Sometimes
Okay. Well, what I noticed right off the bat from this calf's stomach is when I open this thing up, this is hemorrhagic. So you can see some of the blood in that abomasum. How it's kind of got that pink tinge to it. That tells me he's got some more digestive upset than just poor production value. So that could be coccidia, it could be parasites, it could be the fact that he was just running 100 mile an hour with no gas in the tank because of those lungs. But something that I would note. Now, the superficial lining of this abomasum does look a little bit reddened, but not enough that warrants me to think, oh my gosh, we've got a primary like homunculus or something like that. But we can definitely see some ulceration on the surface there. More than likely, this calf probably wasn't eating very well. And so infrequent intakes of feed change the dynamic of that rumen. Probably was going acidotic, unacidotic, acidotic, unacidotic, leading to some of this as well. So it's kind of a vicious cycle that these calves get in. They get sick with pneumonia, they get scarred lungs, it makes them prone to other issues. They go off feed, they come back on feed, now they've got digestive issues, and now it's just a vicious cycle that feeds into itself a little bit. All right, who wants to find the kidney? So think about where our kidneys are at on a human. They're up toward our back, right? Now where's up toward the back? Yep, so the bottom of his abdomen is going to run about right here. And so there's your kidney right there. Now here's the thing. Is there much fat around that? There's a little bit, but like on that calf there, he had none. And so then again, carefully you don't cut yourself. You can use this as a cutting board on the side of the calf too. No, looks good, looks good. Let me see that knife real quick. And so what you kind of look at is some of the structures of this that I'm looking specifically for, like the renal pelvis and some of these other inner working things, just to make sure that there's no abscesses or anything abnormal in there. Your pre-vets, you'll get a whole week on anatomy of the kidney. So kidney looks pretty good, surprisingly, for some of the issues we're seeing. Digestively, the rest of these intestines, you can see some changes. Nothing that warrants any major concern. There may be a little bit of some reddening in here. If you're going to check for coccidiosis, there's a good sample. Put it in a bag, send it to the lab. You can take this to your veterinarian too, if you got a stool sample, or we can milk the samples out of this and do a fecal float in-house as well. But a little bit of some redness on this. Hard to say what it is grossly. But you can see kind of that inner layer being really red. That's not super normal. Is it super bad? No. But something certainly I would put in my pathology report when we see that bright redness of that small intestine.
Was it coccidiosis that you said I could poke the eye?
No, nitrate.
Nitrate. Okay.
So think of like toxin. Think about like toxins and toxicities. Nitrates, lead, not lead like we shot him, but like somebody threw a battery in the feed mixer, or you got calves out on grass and there's an old dump site where somebody dumped a bunch of dead batteries. The thing of it is about lead in general, specifically batteries, if they get broke open and a cattle can smell them and taste them, it smells sweet. It tastes sweet to them. So you'll see cattle that come up to it like a salt block and just lick a lead battery to death. And you'll usually find them not far from it. Sometimes they'll make it home to the water pen, and you'll see them get really neurologic, and you're thinking, oh, what the hell's going on? He's a brainer. Yeah. And it's actually lead toxicity.
So that'd be like the same thing if like somehow my calf got his fertilizer.
Yeah, from a nitrate standpoint, you can do that there. If you think it's a fertilizer issue, especially if there's a liability involved with it, like your neighbor dumped in the ditch up the road that you drink or the calves drink out of, then certainly you're going to want to get a full necropsy done if you're going to do a litigation issue with it. So, or insurance is going to be involved, because if you just test it and say, yeah, he died of nitrates, insurance is going to say, meh, type deal. I've been in on some of those deals too where you need to do a thorough everything, and they'll be like, well, we knew it was this. I'll tell you one of the craziest stories I got in on. We knew exactly how these cattle died, but we had to do full necropsy on 5 steers. The reason they died is because a drunk driver hit a T intersection, went right into the pen, and took 3 of them out at the bunk. We knew exactly what happened because the car was still in there. So we knew exactly what happened.
Yeah.
But from an insurance standpoint, we had to do full necropsy on those to make sure there wasn't anything underlying in that situation. So if it comes to those issues, but a trick that I always like to do is grab ocular fluid, because sometimes those pathologists will see what you're seeing in a different light, and they'll think, well, boy, it'd been really neat to test this thing for whatever. So also from like a grass tetany standpoint, you can check some things like that too. So diagnosis on this guy here, definitely pneumonia. Definitely. We had some other abnormalities in the digestive tract, not to a great extent. This guy would probably be a 9 out of 10 on a severity level. That lung is bad, bad, bad. I mean, the amount of adhesions we got in there, bad, bad, bad. So
Body condition wise, I thought he looked better than this one.
he was. This one actually had a lot more fat in him, and that's one of the things I always look at whenever I cut something open is, well, how much fat is around the heart. So you think about anybody a meats judger or meats major, KPH. What's KPH stand for? Kidney pelvic heart. What's it stand for? Kidney pelvic heart fat. Part of yield grade, right? So they document how much fat is in that intra-abdominal, intrathoracic area. These guys hardly had any. This guy had a little bit more around his kidney. That one had none, absolutely none. That tells me that they were probably in a negative energy balance, meaning even if they were eating a lot of food, which you can see they weren't converting it over enough to maintain their body condition. And so they were probably losing weight. That's why these calves were behind. This is why these calves were probably designated for today. Anything else anybody want to see? So, if you're working on a feed yard, you're working in a stocker program, do you think after today, with one good knife, whether it's from the hunting store, your gutting knife, and a pair of tree nippers, you think you can crack a chest on a steer? It's not too tough. It's not too scary. Doesn't have to be perfect. Won't be your first time. But if you can at least get that leg swung over, get down to the ribs, crack those ribs open, take that picture, that's sometimes enough to help me as a veterinarian. Hey, now grab that lung, pull it out, grab a chunk, send it off to the lab. Let's find out what's going in there. Is it Mannheimia? Is it Pastorella? I would suspect that we've probably got definitely Mannheimia with how many adhesions we saw in him. With it being old, hard to say, but some of those changes in the heart make me think that there's probably a somnus factor in here, Histopheles as well.
You start seeing the joint issues from somnus and
yeah, so
ectoplasm.
you can see that front leg on him. It's already starting to have a little bit of some change to it. I would say we're probably seeing some of that already. Somnus can be a little bit weird. You know, everybody thinks of it as brainers. And if you've got it in the brain, you've got it elsewhere. So if you see a brainer that's Histopheles responsive, then it's probably everywhere. In the joints, you know, usually a month or so after a major event, you'll start seeing some issues. Depends the challenge, right? Depends how much somnus is in there. Depends how bad it was. Depends if they were treated. Depends what they were treated with. Some drugs get into the joints and help prevent that really well. Some don't. Blackleg, Clostridial, we vaccinate for that. You will see some of that sometimes. Mostly if you think of Clostridials, a lot of times I'll see more tetanus issues after an improper banding or some sort of issue with castration. You can see those in the muscles sometimes. You'll cut that back leg open and you'll see some spotting, and it looks like literally black tar in that muscle pattern. A lot of places where I like to look at it is right in the meat of this round. Just cut this thing open and just look in there to see type deal. What else?
I don't know if it's very common, but like salmonella, what do you look for like when you're trying to diagnose that?
Yeah, so where we'll see a lot of salmonella or the enteric E. coli and stuff like that is the beef on dairy or in dairy hutch calves. And salmonella Dublin, essentially what you would see is grab these small intestines like this, and they're going to be bright red like Christmas. And you'll even see some diarrhea. That's also one thing when you see diarrhea in a group of calves, it's not always cocci. It can be salmonella. If I see bloody stools, the two things that I want to rule out is certainly salmonella E. coli and coccidia. And if they're on a history of not being on a coccidiostat or a preventative, then that certainly is going to red flag big time for me that we're ruling that out, number one. Salmonella can also be start in the gut and then cause a sepsis throughout the entire body as well.
So in comparison to like say a dry lot and you do a necropsy on a calf in a slat barn or maybe like a pack barn, so real confined facilities, what do you usually see as in comparison to something like this? Like we're talking about the beef on dairy, that's what we do at home. We're in the north, you can't really get away with using a dry lot. So
Yeah.
kinda,
You'll see some differences based on the grouping of cattle, maybe not necessarily the housing. Now, certain different housing have their different problems. Air quality, I would say, would be number one. And then certainly weather events play a big role in the type of housing. A blizzard in Iowa on a dry lot scenario, those cattle might have some differences from a death standpoint compared to cattle that are in a dust storm. Now, the beef on dairy does pose its challenges because it seems like they have some unique bacterial components and viral issues, but I think it all starts at that baby calf level from a colostrum standpoint. Are they getting quality colostrum? Are those calves getting seeded with those bugs at that dairy before they get into the hutch? And I think that all plays a role. And not to pick on the dairy breed or the dairy industry, but they're all for milk quality, milk fat, milk quantity. The baby calves have been an offsuit, and we don't really take care of them. If it gets colostrum, great. If not, but now they're seeing the value of it, especially with the beef on dairy programs, that maybe colostrum quality is going to be start becoming a bigger deal. And then not only that, but what do they use for colostrum? Do they pasteurize their own home colostrum? Are they using a commercially available one? You know, and so certainly when you start thinking of other diseases, Johne's, mycoplasma, all those things can definitely play a big role from a colostrum management on that calf at that young of age. And then also recognize too, it's shift work. If you've got 100 cows and mama beef cows and you're calving out on the range, you're watching them because it's calving season. Calving season's now between now and the 1st of April. Whereas the dairy, they're calving year round and it's shift work. So cow calves at midnight, gets taken care of at 8 a.m. And so there's some differences in the industry, I think, that puts it at a disadvantage as well. But not all dairies are that way, but generally, colostrum management is poor at dairies.
You see more BRD in feedlots than in dairies?
I think we see it more in the dairy calves, but not necessarily in the dairy cows because a lot of them are beef cow or they're adult, and an adult cow generally doesn't get pneumonia unless there's an inciting cause or issue, something else that's going on in that situation. Now, if you've been listening to the news and certainly reading cattle facts and all that, the high path AI thing is a real deal in some of these adult cows that are causing some pretty serious issues. We are not necessarily seeing it in the adult beef animals. I think it probably is there. We're just not seeing it, or we're not looking for it. Where those dairy cows are a lot more intensely managed, they're seeing that a lot better. Now, we see it a lot more in feedlot cattle because I think we're concentrating those cattle. And we think about how these cattle come to the feed yard. They come from many different operations. They come from many different locations. We have commingling. So it's kind of like if anybody's got kids and you send your kid to kindergarten, the first 2 months, everybody's sick because you're intermingling everybody. And so you're getting all those different bugs in there. And so I don't have the answer for why we have more BRD today than we do, say, 50 years ago. Some of it probably has to be that we're pushing cattle, and we have been naturally selecting these cattle for meat, cutability, quality grade, and we're not selecting for lung size, heart development, and I think that some of that's starting to catch up. So now all of a sudden, we're running red line on our motor on these cattle, and so it's a lot easier for an incite like pneumonia or something like that to cause these cattle to tip over. So that's my personal opinion.
With that being said, like what are some breeds that are kind of more superior with heart sizes, blood sores?
So anybody taking animal breeding yet? Hybrid vigor, the only free lunch. I think crossbreeding does play a role and being able to maximize out some of those things. Now, do I have any scientific data to support that? No. But as for breeds, I know the Angus breed's pushing it pretty hard right now to try to get some of this heart failure thing figured out. I think there is potentially some genetic components to it, whether they want to admit it or not. But that's certainly a personal opinion. Yeah. I'm a Simmental guy, so it's not in the semis. Other thoughts and discussion? Keep them coming.
What are some instances where you crack the skull open and look at the brain? Is it just
Yeah, so
case to case basis, like
yeah.
showing symptoms, not being able to walk correctly?
Any neurologic case that's acting neurologic, brain should be submitted. Certainly, rabies is number one on my radar. Any neurologic case as a veterinarian, anytime you see a neurologic case, rabies should be on your radar, no matter what, because it's just one of those where if somebody gets rabies, there's no coming back from it.
Is the necropsy process different if it's a rabies suspect? Or
Yes.
Is it kind of the same?
Yes. A lot of times I will triple glove, and even sometimes I will have a pair of leather gloves that are sacrificed for that day. Just from a standpoint that if I accidentally cut my finger, the other thing is too, is depending on the size of the animal, I sometimes will take the brains out. Sometimes I'll send the whole head and let the pathologist do it. Anything that's small enough that I can get it shipped under $100, pathologist is going to do it. Anything bigger than that that's going to cost a lot of money to ship it, I'll crack it open. I have a really cool video on how to get brains out. Pathologists don't like it, but it's really good. What you do is you disarticulate the head right here at the back of the foramen magnum, which is the first hole into the back of your skull where your spinal cord comes into your lower brain. You set the head up and you take a punch, like right out of your shop, right on the forehead, like you're going to do a captive bull or shoot a calf, and you tap it in, weasel it out. Actually, you know what? I have my bolt for it too. And you kind of ream out this hole into the brain cavity, and you grab a garden hose, put it up to your hole, and it flushes the whole brain right out the back of the foramen magnum. I'll start including that on the slides to show people, because somebody asked me about that last year. So here's my crappy hammer for it. And that's what I use, because that's just about the right size to tap that sucker in, and I can use a wrench to screw it out if it gets stuck. And then I take that garden hose right up to the edge of the brain where that hole is, and the intra-pressure of that water going in there will flush that brain right out the back. You literally just have somebody stick it back there, and a whole brain will come right in your hand. Every day. As a licensed veterinarian, neurologic diseases are always on your radar. When was the last time I took a brain out of a steer or a cow? It's been a year or two. Yeah.
Yeah, because I've only seen the vet do it once, and he like sawed it open.
So there is a saw way as well. What you do is you basically can come here. Any deer hunters? And if you're not going to do a full skull mount, you just want the antlers. What they do, they take right at the top of the forehead, right at the back, and they make a V. Same thing. You can make your V about right here at the level of the eyes, and cut with your sawzall about right there. They come in from the back side, and then you can pop that thing off just like a Tupperware lid. And then you just go in there with a little pair of scissors and just cut all your meningeals off of there, and you can pull that thing right out. Some guys will use an axe, and they'll do that and chisel it out as well. Boy, it's pretty easy just to tap a hole and pound it out the back type deal. So
It took him like an hour just to get.
yeah. Power tools work very well in doing those types of things. There's a really cool trick too on how to get spinal cords out. Dr. Madsen at Iowa State taught me. What would we need to get a spinal cord out for? Anything, any species. Horse people, I'm looking at you. EPM. So if you need to get a spinal cord out on a horse, you can come in and you can shave. There's a certain size bit, I don't have it, but you put it in your sawzall, a certain size grit that just comes in and shaves the top of those vertebrae off, and then you literally just pull it out like a piece of spaghetti. So you gotta have a little bit of a sense of humor when you get the veterinary medicine. And if you're in my case, you have to have kind of a little bit of a crude sense of humor. Foot lesions. Certainly, we see a lot of lameness issues in feedlot. Those are sometimes a little bit harder to diagnose, but certainly we can run and skin those legs out and try to find abscesses. A lot of times, if you have like a bandsaw, you can actually cut a leg off and then just split it right down the middle with a bandsaw and split that bone open and have a cross section, and then you can start picking out a lot of issues in there from a lameness standpoint too.
Talk a little bit about H5N1. How would that look different in a calf like this?
So the H1N1 stuff is a massive inflammatory response, meaning these cattle are normal today and dead tomorrow. And what you're seeing is extremely inflammatory infiltrates in those lungs and in all the body systems. So the kidneys are affected, the liver's affected, the lungs are affected, the heart's affected, everything from that standpoint. And when you start seeing that massive amount of influx of inflammatory, I usually think like something toxicity. Like there is something toxic going on or an electrocution event. So you'll see that sometimes with lightning or a stray voltage. Cow goes and bites the water heater, ends up getting 220. It'll drop her. And so those types of things is what you'll see with that high path. I have not personally cut any of those open, but Dr. Magstead and a couple other pathologists from A&M and Iowa State have been kind of the go-tos for that. And the documentation that I've seen with it is it looks like a massive inflammatory response. So severe pneumonia, severe heart failure, liver failure, and kidney failure all at once. Which is kind of surprising that a lot of those dairy cows actually come back from it, from some of those lesions inside.
Besides the Lanco, have you tried to set a plan for H1N1, like for producers, or?
So certainly it has not been trickled into the beef world too much, and I'm on the beef side. The dairy world has been monitoring it quite a bit. Let's see, there was a press release a couple of weeks ago that we are starting to work on an H1 or a high path AI vaccine for dairy cows. So I don't know much about it except that that's what we're doing. Yeah.
Dr. Wertz, for your last demonstration, can
Yep.
you show how you put them back together, fix them up?
Yep. All right, pre-vet, you're up. Yeah, I mean, so obviously we've got them all open, right? Splayed open. The dead truck is not going to be very happy. The rendering truck is not going to be very happy if this is what he's got to come back to. And certainly putting them kind of back together a little bit can be helpful. Basically, we throw all the parts and pieces back in and throw the legs back over the top a little bit. Also recognize too that some rendering operations do not want anything in their ears. They will charge you an extra $50 if there's an ear tag in there. Darlington and Nebraska does. So depending on who's coming to pick these up or where they're going, we need to document that as well. And then certainly, like I said, IDs. So then that way when we call the producer and say, yep, 9R or PR or whatever this one is, these is what died from this, that one died from that. If you're taking pictures, have the ID in there as well. Even if it's a sheet of paper, like this is just from pen 2. They don't tag calves. There's no ID on this calf. This is from pen 2. Boom. But then as like I said, the dead truck sometimes doesn't like these all splayed open. So you just throw all the parts and pieces back in. Good as new. Sending to the home pen. Work with your guys that are doing the dead truck and stuff, and ask them how they want them put together. Some people will say any parts and pieces that fall off, I ain't touching. Some people are like throwing them up in the truck. We had a guy one time at the clinic that he threw a bunch in our dumpster. Yeah, and it was July. So yeah. That was a fun day. Yeah. Um,
Dr. Levine, Matt, anything else? No. Thank you guys for each spring.
Have to stay around if anybody's got questions about any of our positions or any stay. Ask more questions about what we're doing. Appreciate y'all letting us come in and do it. It's helpful. Help you out in some way.
Thank you guys for your time and investment in helping us out.
also recognize we are here as a resource too. Whether you get into practice or into production, if you have questions, call us. That's why we're here. Because our success is ultimately our customer success, which soon or already is going to be you guys.